about the cases and where we're at. And if we look at the cases across Washington state, they're very stable right now, but they stabilized out at a very high level. These levels tend to be higher than some of our other waves. But the good news is that there has been some mild decrease, mostly in all ages. And the same goes for hospitalizations. We seem to have stabilized out, but we're still having mild decreases. You can see some of this incomplete data still shows some decreasing, but most age groups have started to decrease in their hospitalizations, but our occupancy in the hospitals, which is common at this time of year, still remains incredibly high. And as Dr. Shah said, a lot of this is due to the start of our respiratory virus season. So this year, in addition to COVID, we have to be concerned about things like croup or RSV or some of these other common respiratory viruses. I'm in practice today seeing patient after patient with respiratory virus that is not COVID. So this is really complicating the picture. And as said before, one way to simplify and decrease the burden on the hospitals and the clinics is to make sure you get your flu shot also, so we can take that out of the equation. Now, the big issue on everyone's mind right now is about kids. And our kids are tending to have very high case rates. We've had 7,400 cases in Washington state in kids, and Northeast Washington being the hardest hit in the state. So it's not equal across the state, but the rates in kids are incredibly high. It's like 390 per 100,000. These are rates way higher than we were used to speaking in the general population early in the pandemic. So we're at very high case levels, even though they are showing some decrease. The good news to this is that we are starting to see some increase in our what we call community immunity, or either natural immunity or from vaccination. And clearly the ideal and the best vaccination, plus even if you've had a case, is probably your best chance of being protected. That all affects what we call our R effective, and many are used to talking about this term, but we really look to get our R effective or R naught value less than 1. And at this point, it looks like we're reaching that. The concern still being, though, that the major variant we are seeing is Delta. All our variants out of our random sampling right now are Delta variant. And one of the big concerns is, are we seeing an increase in our breakthrough cases? So these are people that have been vaccinated that developed disease or had disease before and developed disease again. And the good news is that percentage is remaining fairly constant. It's around 69,000 cases, which is what is expected for the state of Washington. That is less than one, that's really less than 1.5%. So these are still very small events in the big picture. But it is not just about science or people's opinions or politics here. What we observe is that if you are between 12 and 34, you're 5 times more likely to have COVID if you're unvaccinated, and you're 13 times more likely to be hospitalized. So those trends are pretty constant across the age groups. So that real data that we are experiencing is showing us the protection that the vaccine affords. And so one of the things I want to summarize here is that our community immunity is rising, and this is the perfect time to get vaccinated. Don't get the disease, get vaccinated. And we're right on the cusp of vaccinating a large population of kids. This will definitely help with our community spread of COVID. And at this point, with the R effective being so promising, I think we're really on the cusp of being able to turn this 5th wave down pretty good. Still doesn't negate the need to wear your mask. Really wearing your mask is protection. And then Lacey's going to talk a bit about large gatherings and how to safely navigate this, certainly for the holidays and large gatherings. So all those principles, vaccination, mask, and distancing from others will very much help us get out of this 5th wave. And with that, I turn it back to you, Julie.